there's more to treating someone than curing their infection. When we go into beginning to treat a patient with chronic hepatitis B or chronic hepatitis C, our first goal is to cure them with hepatitis C and with hepatitis B to get their infection under control. But there are ramifications that go well beyond the clinic. For example, even with the patient themselves, the patients themselves, we see that when you're able to cure an infection, it has implications in their sense of well-being. In many instances, they carry the burden of their chronic infection with them and sometimes aren't even aware of how much it's weighing on their sense of well-being and all the stigma and other things that come with having a chronic condition. And you tell them they're cured, and you can just see it in their face that something's changed, and there's immediate improvements in sense of well-being and a sense in which they've really psychologically put something that they've been carrying for a long time behind them. And it's hard to measure that, of course, in any sort of using any sort of laboratory test. But that, first of all, is a secondary benefit of treating and curing someone, is giving them the sense that they've cured and they've eradicated, they've gone beyond something that's really been weighing on them. Moving out from the individual patient, there's implications really on their families. It's another difficult to measure feature of treating and curing hepatitis, but oftentimes there's unspoken tensions within relationships when one person might be, for example, fearing that they're going to get an infection from another. And when you've been able to cure the individual and tell them and tell their loved ones they have no risk to anyone anymore, that's an added benefit. There is good evidence that persons with chronic hepatitis have marked increase in medical expenses. Not just even necessarily the cost of their hepatitis medicines, but even other associated testing and consequences of having had hepatitis. In one large study of managed care organization, people with hepatitis had more than double the costs that people without hepatitis had. And so if you can cure the hepatitis, you can really diminish the economic impact of these infections on society in general. There's also evidence that persons with chronic hepatitis have increased absences from work and that they have other implications on the workplace and on society in general. And so if you're able to cure them, once again, everyone benefits. So there's our first goal is to cure a patient or to get their hepatitis B under control, but there are widespread implications to those successes.